Now, as you're considering whether ketamine infusion therapy is the right move for you, probably some questions are coming up. So I'm going to try and address in this short video some of the most common questions that my patients have asked me over the years. Now, first off is ketamine safe? Now, ketamine is an anesthetic. It is the most commonly used anesthetic in children's hospitals. So it is very safe. It doesn't lower your heart rate, it doesn't lower your blood pressure, all things that other anesthetics do. And again, we're using very tiny doses. This is 1/10 the dose that we're using in the hospitals for anesthesia. So you're not going to sleep and having surgery, you're relaxing and floating a little bit. The second thing to keep in mind about ketamine and safety is that it does increase blood pressure for some people. So if you have high blood pressure to begin with, you want to either make sure that's under good control, but we're watching your blood pressure. And part of our model is to be safe. So our nurse anesthetists are monitoring you all the time. We are in the room monitoring you with Q5 vitals, EKG, blood pressure, pulse ox throughout the entire infusion. You're never alone. Number two, most common thing that people raise a concern about is, am I getting addicted to this stuff? It's a street drug. I mean, it's a horse tranquilizer. It's ketamine. Well, so there's a lot of stuff out there about, ketamine, because for years, yes, it was stolen from vet clinics and used as a street drug. And it's still abused as a street drug. But those doses are about 100 times higher than what we are using to treat depression. And in our experience over 9 years, hundreds and hundreds of patients, no one has gotten addicted to ketamine. No one has come back and say, hey, can I get a few more infusions because that's a whole lot of fun. No one's saying that to me. And nationwide, a decade of experience, there have been no reports of people becoming addicted to ketamine from intravenous infusion therapy. A third concern that comes up about ketamine is, gosh, what's this going to feel like? And everyone comes in a little bit nervous and a little bit scared for their first infusion because you don't know what to expect. So I'm going to tell you. So ketamine is, at these low doses, you'll feel floaty, you'll feel kind of a little bit like you can't quite feel your skin normally. The blinds might waver a little bit, but you're not going to be hallucinating. No pink elephants or dancing turtles. But I do love the dancing turtles. So if you do have the dancing turtle hallucination, please tell me about it because it's my favorite hallucination of all time. But realistically, none of our patients have hallucinations. The doses that we use, it just doesn't happen. You don't need to go to those high doses in order to get the antidepressant benefit of ketamine. Don't let people tell you that, oh, you must hallucinate in order to get that improvement. It's not true. Other things to keep in mind about ketamine infusion therapy is you can't just walk in, get a ketamine infusion, and drive yourself home. Someone must drive you home because you've had anesthesia. That's just being safe. Another thing about getting anesthesia is that you need to be not have eaten anything or drank anything for 6 hours before your infusion, what we call NPO. So nothing to eat or drink for 6 hours before your infusion. Have someone to give you a ride home or use ride-sharing services, and come in, get ketamine. We have a 72% response rate, higher than the national average. And we're not doing ketamine infusion therapy, 6 infusions in 2 weeks like most other clinics are doing, because that doesn't make any sense. At most, we'll do 1 infusion a week.